But we tend to favor a stentless valve here. So it's the pink valve. It comes as a aorta, and we just sew it into your aorta without the stent, so there's more room for the blood to flow.
So there's no anti-rejection drugs needed for that? Or?
No. And the reason they don't last more than 15, 20 years, the younger you are, the less they seem to last. If you're 60 or above, 90% last their whole life.
Because they're not working as hard, probably, right?
Well, maybe not working as hard, or maybe there is some rejection going on, but we just haven't found a risk-benefit way to treat that problem without causing more problems.
So if I did get a tissue valve, I would be looking at another open heart surgery down the road, 15, 20 years.
Now, right now that's the case. They are coming out with valves that can be put in without surgery. These percutaneous valves. So it goes into a femoral artery, they float this catheter-based thing up into the heart and blow up with the balloon and stretch the new valve in your old valve.
That's weird. It's amazing.
Can we do that? We don't have to do it.
So right now those were first approved for patients that were choosing to have surgery. Too frail, too sick to undergo the risk of surgery. But they worked out so well, they've expanded the indications. So now they're becoming more widely available. Still not available for you, and I don't know that we know how long they'll last. These are been in for like 5 years. It looks like they're going to be pretty good, but I don't know that we know that they're better than the surgical valve. So at least the first one we'd say surgery is probably the way to go.
So he's for sure have to do open heart, because I've heard you can go through the back for certain heart surgeries or through the groin on other,
Yeah.
depending on what you're fixing.
Right. And once they go through the back of the side, it's still open heart.
Oh,
It's just a different approach. So cosmetically, they put the scar in a different place.
Yeah. So do you cut straight through the bone?
Yeah.
And I guess it heals better that way versus the cartilage or something on the side.
Yeah, the cartilage doesn't heal as well. And your CT scan is nice. You've got a nice wide bone, good density. She doesn't look like cartilage healing.
Good for cutting.
The good thing about going heart surgery when you're young is you heal better.
Yeah.
The bad thing is you're young and you're gonna outlast any valve we put in except for a mechanical valve. And so yeah, we probably should tell you that you'll have another surgery at some point. Hopefully this new technology really blossoms, and in 5 or 10 or 15 years, whenever that valve starts to have problems, they'll have an option to do without surgery.
So when those biovalves have problems, what happens to them? Do they calcify or what?
Yeah, there's two, either they calcify or the leaflets tear. And it's probably because the leaflet is a little stiff, and the stresses on the leaflet just cause it to tear.
So I'm not supposed to be working out or doing any physical activity right now.
I think with a leaky valve, anything you do that causes you to strain, to hold your breath and force a lot of effort, that's probably something you should avoid.
So any strain, any long distance running or anything?
So, some aerobic activity I think is good. I wouldn't say you should stop all activity. So it'll get your heart rate up, it'll get your blood pressure up a little bit. The other thing with bicuspid valves is whatever genetic thing that caused the 2 leaflets instead of 3 also seems to affect some of the lining of the blood vessels. The collagen strength of your aorta may not be as good as others. In fact, your CAT scan was done to see if there was any aneurysm, any growth. And it is a little bit large. So generally, if it's 5.5 to 6 centimeters in size, we're requesting an operation or recommending an operation to fix your aorta.
Okay, so right now being at 4.5, I'm not too bad.
Well, if you have a bicuspid valve, then we lower that down a little bit and say 4.5 is kind of the borderline, and you're kind of right there.
Yeah, we just don't want to like suddenly die if
Yeah.
it works out. So.
Right. So I don't think that's a big risk, but I think that's, if we're there to work on the valve, at 4.5 to 5 in a bicuspid patient, we should probably replace the ACE inhibitor as well.
So replacing that, is that also with a big part, or is that?
Dacron. There's Dacron and Gore-Tex. There's people that make tubes out of synthetic material, and we just cut out the aneurysmal portion and put in a tube.
And that doesn't need any anti-rejection?
No. It looks like the part that holds the valve, the root of the aorta, is okay, which makes it less complicated to do. So we're just putting a tube of material in to replace that part above the valve to where the circuit branch above into the neck and the arms.
So what would you suggest for timing?
Well, that's a good question. I think with you're having symptoms, your heart's enlarged, I don't think we need to really wait much longer. So now it's just not to rush into it, but I don't think I'm waiting a year, although it's probably fine. I mean, I think we could, if you decided that, yeah, I've got too much going on right now, I want to push this off a little bit, I think we'd look at 6 months to get another echo just to make sure there's been no change, and then just kind of watch your symptoms close. The other thing with, we work on valves, any kind of valve you put in, biologic or mechanical, we work on infections. Anytime you go to a dentist from here on out, they'll ask you if you have any prosthetic material in your aorta. You'll say yes, they'll probably recommend antibiotics. If you need any dental work, that's something we should probably do first before we do the valve.
So can you like scuba dive still?
Before, after should be no problem once you've recovered from all this. Yeah, there's really no problem with scuba diving that I can see. Lifting is okay, but not powerlifting. I mean, lighter weights and more reps kind of thing. I'm not in the process. I'm not sure what that entails. It's very intense for sure.
Intense.
Yeah.
So there's what, next month, a 20-mile?
Ragnar, can you run that much, or is that gonna make it hard?
Yeah, so what have you been doing up till now? Have you been running that much?
Well,
I just started running more, like I did a 16 or a 12.4 mile Spartan race. So I was running and doing obstacles for 4 hours. And my chest starts to hurt a little bit, and
Yeah.
so I did slow down a little bit.
I think
So I don't know.
you could do that, but I wouldn't push yourself to where you can't, have trouble catching your breath. Sometimes people just push.
Mm-hmm.
But I don't get to that point where you're going to black out and you're getting television.
Yeah, I don't want to die,
Shortness of
so.
breath, yeah, but I think if you're kind of use common sense and listen to your body and don't overstress yourself, I don't think there's any reason you can't.
That's amazing. It's amazing your heart accepts that. I'm surprised that they don't just leak. Like, once you sew them, like there's
Yeah.
blood pressure in there.
Yeah, right, and sometimes we will see some leakage at this sewing from the needle holes, but often.
So do you have I guess you have a drain in there. You leave a drain for a few days or something.
Yeah, one or two usually, kind of little drains that go around the pericardial sac that any leakage of fluid is absorbed and taken out. Your body will reabsorb a lot of the fluid afterwards, so we don't wait till there's no drainage. So we want to make sure that drainage is kind of on the low side.
So would I be bedridden for like the whole 2 months? or-
No, usually you're in the hospital about a week. 5 days kind of is the average. After the surgery, you go to the ICU. That evening, you're getting awake, getting the breathing tube out, getting up to a chair. Next day, you're walking. In fact, you walk from ICU to the regular ward. It's kind of expected. And then every day, you'll do some walking 2-3 times a day. After you leave the hospital, we kind of expect most of the patients that have walked 30 minutes nonstop in 30 days. You should do that much sooner than 30 days. But if you overdo it, you'll be just wiped out and not want to do it the next day. So it's more frequency. So you won't be able to do much with the upper body until that bone heals.
Mhm.
That's 6 weeks or so.
So the bones heal all completely enough to like do push-ups and stuff by
Yeah.
6 weeks?
Yeah.
Wow.
6 to 8 weeks, probably 6 weeks, you have 90% of your strength back. In 8 weeks, there's no restrictions in 8 weeks.
Wow.
So you can schedule it for December 8th, after your Spartan, and finish your trifecta.
And then after that, how often do you like to see patients come in?
So I will see you about a month afterwards to make sure things are healing okay.
Mhm.
Then we get you plugged back into Dr. Jensen, and be your main follow-up guy. We don't need to get an echo every year, but if we do it every year on the anniversary of surgery, you won't forget. And that's just a way to track how the valve's doing. And right now, insurance companies pay for that, so it's good. If they decide they won't cover it every year, then we may have to rethink it, and you know, have to be, was it even year, odd year, if we do it every other year or something. But it's just easier for patients to remember every year rather than every other.
So in the surgery, there's a few surgeons here.
Yeah.
Is everybody, all the surgeons come in to the procedure?
We have three of us.
So you, Woodbury, and
Bowles. So we all work together. Usually on a case like this, we help, so there'd be not all three, but there'd be two. There's another 10 people in the room. We have scrub techs and nurses and anesthesiologists and people that run the echo machine. So it's quite a team effort. And I'm happy to have you see one of my partners too if you wanted to meet everybody.
we just know Woodbury did our neighbor's
Oh,
heart. She
okay.
just barely had a mouth.
She's alive, so
She's
that's
still
good.
alive. We were waiting for her this weekend. He's gonna die and everything. So.
Yeah, unfortunately, my partners are great. We all work together.